Now, COVID-19 restrictions such as curfews have an impact on maternal and child health. Accessing health facilities for women and mothers in need of maternal services was a struggle. Imagine a pregnant woman in need of medical attention in the middle of the night, or worse, laboring at night. The situation for pregnant women in Kibra slums was worse. However, the society and caregivers had to find a way to avoid home deliveries for the safety of both the mother and child.
For us as a facility, we sat down and decided any client who comes during that curfew time, whether they are in labor or not, we will give them, somewhere to sleep until the next day. If they are not in labor, the next morning they can go home safe. If they're in labor, we continue with them with the journey during delivery. But for the relatives, we usually write for them notes. We were writing for them notes and signing and putting a stamp. But people here in the community are very tough because they come as a group. They come, a lot of them, so I feel like no one will do. Hakuna mtu angewasumbua kwa barabara. Wanakuja kikundi, neighbors, wanaume wamebeba panga nini, just for security purposes for them. And tunaandika tu majina zao chini wote. We explain these are people who brought this mother to the facility. Can you allow them to go back home? But for the clients, we never released any client during that curfew to go home because this is a mother who is pregnant. There's a baby inside her. So we're trying to protect her and the baby.
According to Savan Shah, his facility had to partner with a taxi company to bring in any pregnant woman who was seeking health services past the curfew hours.
In order to ensure that our patients can come to the facility and deliver without going through the anxiety of having to drive themselves and wondering whether they're going to be stopped by any askaris in town. So that's something that we put in place very, very early on.
We can only imagine how the situation would have been if facilities such as Jacaranda and Tabitha Maternity did not think outside the box. With COVID-19, the public was cautioned against gatherings in public places. Pregnant and lactating mothers being at risk, they avoided such places completely. To some, this meant avoiding health facilities for fear of contracting COVID-19. However, it also meant putting their lives at risk.
We'll get a lot of defaulters in our child welfare clinics, and even for pregnant mothers who are supposed to be coming for their clinics every month. For the maternity services, a lot of people lost their jobs. The spouses were out of work, so you will feel like the charges that we give, or the charges that we usually get for the package of maternity, they were not able to get that finance. So that will make them maybe go back to the old ways where they would now do home deliveries. Some of the things we did is we started our defaulter tracing, where we created we sat as a team and discussed, and we saw through defaulter tracing we will be able to also get information as to why these clients are not coming to the facility. And yes, some of them were coming, and some of them at least understood why there is need to come to the clinic for these services.
These women, of course, were scared to come to hospital, understandably so. So the numbers have gone down. Although with social distancing, with proper protocols, we have isolation departments in most facilities. We still encourage pregnant women to definitely come for their antenatal care.
The full lockdown could result in something as dramatic as mothers not being able to make their way to a hospital facility and delivering at home. And it is a proven concept that if you are going to have a pregnancy at home, you're going to have way more risks, particularly if that pregnancy at that point in time complicates. There are so many risks, so many challenges with a home-based delivery. You are way better off delivering at a facility. So that could be as dramatic as that.
According to Simfros, she becomes anxious when she thinks of going to the hospital for her usual clinics.
There's a lot of anxiety, especially when you have to go to a crowded place, when you have to go to the hospital, and then it becomes so hard to be able to stay safe all through, because we use matatus. I go to the market, you come to the hospital, people are sick, so I think just living one step at a time. Yeah.
Being a lactating mom and having a baby who is younger, like below 6 months, I wouldn't risk leaving the house each and every time, because if you go to the hospital, you're risking coming into contact with people. My baby is still small. I can't put a mask on her. So somebody might cough near me and these droplets of his or her saliva get to my baby, because right now people are very reluctant about wearing a mask. People don't really believe COVID is real unless they see it happening to somebody else. So a lot of people don't really wear masks unless they are forced to wear it, like when coming to a facility like this one, or going to an office where there is a security guard there who insists you have to wear a mask. If not, you're not allowed in.
At the gate, as is mandatory, there's a need for a temperature check, and hand washing stations were put in place to ensure that, at least on the respiratory and hand hygiene, that all the patients that were walking in were feeling protected.
After her antenatal clinic, Simfros is here today for an ultrasound. Despite the anxiety and fear, she has to look after herself and her baby.
This is one leg and this is the other leg, so you look in between them.
It is said that you can never understand life until it grows inside you, and the joy of a mother is to be told that the baby they are carrying is well and healthy.
It's a beautiful experience, and it's not obvious that when you're carrying a pregnancy, then it is a normal one, the baby is okay. So I'm happy to hear that so far my baby is doing well, she's okay, and it's a she, by the way. And just hearing the heartbeat, kujua there's a human being who is doing well, breathing okay. I'm just happy as a mom.
Both from nutrition, exercise, well-being, mental and physical, so that you are setting yourself up for success when it comes to that beautiful day where you're going to be delivering your baby. You know, everybody wants and hopes and prays for it to be an exceptional journey and with a fantastic ending, and we want that more than anybody else. So we just want to share with that by encouraging people to start their journey as early as possible. You know you're pregnant, start your journey, go for a visit, go for a prenatal checkup. It's very important.
With the COVID-19 pandemic came an increase in teenage pregnancy, yet another threat to maternal and child health. Purity Okinda, a 19-year-old, is 8 months pregnant. She sat for her Form 4 exams not knowing she was pregnant. With all the signs that comes with pregnancy, she thought she had pneumonia.
Siku nilikuwa namaliza mtihani, hiyo siku nilitapikanga. Sasa hiyo kutapika ikazidi. Nikaenda usiku kupimwa. Nikapatikana niko na mimba kama nishamaliza mtihani, lakini nilishtuka sikuamini. Nikaenda nikaambia baba mtoto niko na mimba. Kaniambia tu nisitoe, nikae nayo.
Purity, representing other teenage mothers, did not start her antenatal clinics at the right time. As soon as you're pregnant, one is advised to start the antenatal clinics to check that her and the baby are healthy and doing well.
That's where we tell them of the danger signs, including bleeding, because you're not supposed to see any bleeding during pregnancy. If you see any spotting, you report to the facility. Fetal movement, a mother always listens or feels the fetal movements of the baby. So once you feel they are reduced or they are not there at all, you have to report to the facility. When the water breaks, that is into a drainage of liquor or even rupture of membranes. You will see a mother who will stay even at home for a week. They are just draining because they do not know. But when they come to these antenatal visits, usually you give them these health talks and you teach them.
Wenye nilijua niko na mimba, huyo daktari akaniambia niende nianze clinic. Nikaenda hapo kwa hiyo bench ya clinic, nikasimama, kitu tu ikanisimamisha. Nikatoka tu hapo nikicheka, yani hata siamini.
Because they fall pregnant at such a tender age, they also, many of them are scared to seek healthcare. Many of them try and hide the pregnancy, and some are successful to hide it for a very long time. almost up to the point of delivery, some even up to the point of delivery.
According to Dr. Momanyi, the increase in teenage pregnancy could mean an increase in fistula cases in the near future. Many teenage mothers did not know the importance of the antenatal clinics, and some even went for delivery without attending any clinics.
You find that when you are not followed up antenatally, you tend to have a higher risk of delivery complications. There could have been interventions done before you get to labor, which you've not had. So with this increased risk of delivery complications, we also have an increased risk of, for example, trauma during delivery. That is now what will cause the fistula, which is now that abnormal communication from the urine to pass the wrong side, right? And come out through the vagina, which is not supposed to do, right? So there's definitely a risk. First of all, they are young girls, they have not fully developed. So even their passages have not fully developed. And combined with inadequate health care, the risk just goes up. So it is very conceivable that fistula rates might go up, as well as other complications.
According to the COVID-19 statistics of daily infections in Kenya by the Ministry of Health, in the month of September, an infant was part of the statistics, with the youngest being an 11-day-old infant.
What's worse is you could end up having a delivery of a perfectly normal baby who unfortunately contracts COVID and passes away.
These numbers indicate a threat to maternal and child health. A lot can be done to avoid a spike in infant COVID-19 cases.
You know, pregnancy is delicate. And anytime you're supposed to be in a position where you can be able to reach a doctor or a health center, but because of the curfews, because of the financial constraints, you always having challenges. So just like I said, you live just one step at a time, but it's a very, very tricky time to have a baby. But we're just optimistic that eventually everything will be well.
COVID has really taken over. And they've forgotten, like, we need to ensure zero maternal, zero neonatal, the emphasis that was there before because of this COVID. And I'm hoping that soon they will come back, you know, and try to explain to us or try to bring out on how to manage these mothers, and also, you know, try to encourage us on how to manage them, because I feel like, especially with the maternal part, I'm not hearing a lot about it.
There's a lot of myths and misconceptions going around that the government needs to offset. They should have like a seminar where us lactating moms or representatives of moms can sit down and explain to us what to expect once we've taken this jab, or if it's even safe for us to take this jab.
It's all a matter of the total capacity. So the total capacity, if it increases, there is space both to prepare for COVID and also to maintain or improve health care for all other conditions. So going forward, I think that balance is what we are trying to achieve. If we all combine our forces together, we should be able to adequately take care of both COVID patients as well as any other medical conditions that require healthcare in facilities.
So Ida, in healthcare in particular, burnout is a big problem for healthcare workers. And to ensure that mental well-being and just feeling of safety is put in place for healthcare workers, you are indirectly, actually I would say directly, giving back to ensure that patients' outcomes are as positive as possible. It means that from a delivery perspective, there's a well-managed care that takes place, and from a neonatal perspective, it means that the baby that's delivered is also looked after.
Be the reasonable person in a world where people are unreasonable. And Kenya people are very unreasonable. You've seen them going to political rallies without masks. They are all crowding in funerals, in churches, without following protocols. The world is very unreasonable in Kenya. But if we get a few reasonable people you will protect so many lives. And so that responsibility lies with me and you.
Now, we do not know how long the COVID-19 pandemic will last, but what we know is that there will be life after the COVID-19 pandemic. And therefore, as the world and Kenya in particular tries to flatten the COVID-19 curve, we should be careful not to have an emergency in maternal and child health. And we can do this by having a balance in resource sharing and provision of the much needed information, and definitely playing our role as citizens.